Welcome, friends. I'm Dr. Rajsree Nambudripad, and today we're going to dive into one of the most controversial diets on the internet, the carnivore diet and its impact on the gut microbiome. In my practice, I specialize in the gut microbiome, and I help patients with all types of digestive symptoms. So testing the gut microbiome is something I do every day in my practice. Have you ever wondered what happens to the gut microbiome when you go on a carnivore diet and eliminate all plant foods? So no fruits, no vegetables, no grains, zero fiber. Just meat and animal products for months or even a year or longer. So can the carnivore diet truly heal chronic illnesses? Or does it quietly damage the gut microbiome? Online, opinions are extreme. Some claim it's the cure for everything from bloating to autoimmune disease, while others warn that it could wreck your microbiome and increase your long-term disease risk. So what's the truth? Today, let's move past opinions and look at the objective stool microbiome data from two of my patients who went full carnivore. One stayed on it for a year and the other for 4 months. So they both cut out all plant foods and had zero fiber. But interestingly, they had very different outcomes. So be sure to watch the whole video. But before we get into their cases, let's review the philosophy behind the carnivore diet. The central claim of the carnivore diet is that fiber is not essential, and that by eliminating all plant foods, you reduce inflammation in the gut as well as the whole body. Proponents argue that plants have anti-nutrients like lectins, oxalates, and phytates that irritate the gut, and that by eliminating them, you unlock deep healing. But is that really true? Does eliminating all fiber help the gut or harm it? Because everything we've been taught says fiber is essential for feeding our gut bacteria and producing postbiotics like butyrate, which fuel and protect the colon. So what really happens to your gut microbiome when you go carnivore? Well, let me show you. My first patient is a 19-year-old woman with Hashimoto's hypothyroidism and a long history of gastrointestinal symptoms with bloating, constipation, and a complicated relationship with food. As a teenager, she battled anorexia and was using laxatives and senna teas. In more recent years, she was diagnosed multiple times with intestinal methanogen overgrowth, also known as methane SIBO, and this was confirmed on a breath test in 2021, 2022, and 2024. And this can be a big root cause of bloating and constipation. So prior to seeing me, she had already been through all the standard treatments for SIBO, including antibiotics, herbal antimicrobials, and restrictive diets. But nothing seemed to work. Then in April of 2024, she watched a TED Talk that changed everything. It praised the carnivore diet as the ultimate cure, and she was convinced. So she went all in. Zero fruit, zero vegetables, zero grains, zero fiber. Additionally, she took no vitamins or supplements. So no probiotics, no digestive enzymes, no vitamins whatsoever. Just meat and animal products. And she told me that the carnivore diet was so satiating that she only ate 1 meal per day. But after a full year of this extreme diet, she was still bloated. So that's when she came to see me. She was also having constipation because she only had a small bowel movement once or twice a week. On physical exam, her abdomen was visibly distended, not what you'd expect for someone eating only 1 carnivore meal per day. So I ordered a comprehensive stool microbiome test, and this is what it showed. Her fecal fat was high normal, suggesting her body wasn't digesting fat sufficiently. And obviously the carnivore diet is high in fat. Her calprotectin, a serious marker of inflammation, was elevated at 259, which is a red flag. Calprotectin is a marker of inflammation that can be associated with inflammatory bowel disease, which is Crohn's or ulcerative colitis. Now, she did have an endoscopy and colonoscopy recently, which were normal, but remember, these scopes don't visualize most of the small intestine, so I was concerned about her elevated calprotectin. In addition, she had a bacterial imbalance, which we call dysbiosis. Her microbiome test showed that she had undetectable lactobacillus, which is a good bacteria, as well as oxalobacter. Oxalobacter is the bacteria in our gut that helps us break down oxalates, which is present in spinach or chard. So after a year of not eating any plant foods, these essential bacteria had vanished. Now let's look at her gut microbiome metabolites, which are postbiotics made by the bacteria in her gut. At the top, I put a reminder on how our gut makes postbiotics. The good bacteria in our gut ferments fiber in our diet, and that's how we make postbiotics. So it was no surprise that her postbiotics, which are the short-chain fatty acids, such as butyrate, were extremely low, in fact, nearly absent. Next, her test for leaky gut, which is zonulin, was 157, which was right at the upper limit of normal. This could suggest increased intestinal permeability or borderline leaky gut. Surprisingly, the bacteria responsible for intestinal methanogen overgrowth, called Methanobrevibacter smithii, did not show up on her stool test. But her SIBO breath test was clearly still positive, with a methane level of 22. The good news is she had no parasites or candida overgrowth. So now let's discuss these results. So was her gut healthy after a year on the carnivore diet? Unfortunately, it was not. Her gut was inflamed. It was imbalanced, which we call dysbiosis. It was missing good bacteria like lactobacillus. And she had extremely low postbiotics, which are the short-chain fatty acids in butyrate. And symptomatically, she was still struggling with bloating and constipation. Additionally, the diet did not resolve her intestinal methanogen overgrowth, also known as methane SIBO. And that's because it didn't address the big underlying root causes of SIBO, which in her case were sluggish motility, difficulty digesting fats, and dysbiosis, including the absence of lactobacillus. And all of these root causes are common in patients with hypothyroidism and Hashimoto's. Now, this is what I recommended to help heal her gut. I recommended IgG Guard, which are immunoglobulins, to heal the inflammation in her gut, Probiotic 100 billion to restore the lactobacillus that she was missing, Digestive Enzyme Pro to improve fat digestion and reduce her bloating, Essential Magnesium at bedtime to help with bowel regularity, and Motility Activator, a prokinetic to activate the cleaning waves in her gut, known as the migrating motor complex to help her bloating. And then I recommended that we slowly work in a few tolerated cooked vegetables and then gradual reintroduction of prebiotic fiber and butyrate. I believe we could have rebuilt her microbiome and resolved all of her symptoms, and eventually expanded her diet successfully. Unfortunately, the patient wasn't ready to make any changes to her diet or try any of these supplements. So although I respected her decision, it did limit the options we had to truly heal her gut. I did encourage her to repeat her calprotectin level, and 2 months later it had come down from 259 to 148. But it was still elevated because normal is under 50. So I was concerned about her elevated calprotectin, and I encouraged her to follow up with her gastroenterologist for further evaluation. Now let's move on to my second patient, who is a 36-year-old woman who was recently diagnosed with ulcerative colitis, which is a form of inflammatory bowel disease. So it's a chronic autoimmune condition that causes inflammation in the colon as well as bloody stools. Her symptoms began about a year ago when her diet was poor. So at that time, she was actually eating a standard American diet, and she was overweight, weighing over 200 pounds, and she started having bloody stools on a daily basis. She had already undergone 2 colonoscopies. The first showed proctitis, which is inflammation of the rectum, and the second revealed inflammation of the transverse colon. She was being treated with mesalamine, which is an anti-inflammatory medication, both orally and through an enema. But despite this, her symptoms persisted, and her calprotectin, that inflammation marker, skyrocketed to over 1,000, suggesting she had serious inflammation in her colon. Her gastroenterologist recommended that she start a biologic medication, which is a serious immunosuppressive drug that's used in moderate to severe ulcerative colitis. But she wasn't ready to go down that road, especially given some of the potential side effects of biologic medications. So instead, she did something drastic. She committed to a strict carnivore diet. So she ate meat, chicken, eggs, fish, and butter. She also supplemented with an organ meat protein powder, and she included some extra fats in her diet, like red palm oil, black seed cumin oil, and C60 oil. She made sure that she had 1 gram of fat for every gram of protein in her diet. So 70% of her calories were coming from fat, and this ratio will generally put you into ketosis. She also supplemented with high-dose probiotics and a high dose of vitamin D. So she cut out all plant foods and had zero fiber. Within weeks, something remarkable happened. All her bleeding stopped. Over the next few months, she lost more than 50 pounds, and her energy improved dramatically. And recall, she was actually overweight initially, so this was desired weight loss. On physical exam, she looked vibrant. Her energy was good and her skin was glowing. And she was able to return to doing yoga regularly and return to work working part-time as a hairstylist. She reported no bloating, no urgency, no bleeding, and no abdominal pain. And here's what surprised me the most. Despite having zero fiber in her diet, she was having a fully formed bowel movement every day. In fact, she took out her phone and showed me a picture of her stool, which was fully formed with a little bit of white mucus. Not what you'd expect from a zero fiber diet. So how was this even possible? I believe that the key difference was that she was taking high-dose probiotics once or twice a day. We often forget that stool is not just made out of undigested food, it's also made up of bacterial byproducts. So this is what her gut microbiome test looked like after 4 months on the carnivore diet. And there were definitely some differences compared to our first patient. Her calprotectin completely normalized and was under 11. Remember, it was previously over 1,000. So this was amazing, and it meant that her inflammation was completely gone. Her zonulin, the test for leaky gut, was 110, which was within the normal range. Now let's look at her bacterial profile. Her lactobacillus levels, which are a good bacteria, was actually normal thanks to the probiotics she was using. Her oxalobacter was still detectable, which was amazing given that she had gone 4 months without eating any oxalates, and she was negative for parasites and H. pylori. But there were also some trade-offs. Her bacterial profile showed that she had dysbiosis, meaning a bacterial imbalance. So she had very low levels of bifidobacterium, which is a good bacteria, and she had undetectable levels of Akkermansia, a bacteria critical for maintaining the gut's mucus lining, and it's often missing in patients with inflammatory bowel disease and obesity. So she had significant dysbiosis based on a high reference variance of her bacteria, and her dysbiosis score was a 10. This confirmed persistent microbiome imbalance beneath the surface, and this is classically associated with inflammatory bowel disease. Her postbiotics, which are the short-chain fatty acids and butyrate, were extremely low. And again, this is expected with zero fiber in the diet. So while her inflammation resolved and she clinically felt fantastic, her microbiome remained imbalanced. And although her symptoms improved dramatically, I saw an opportunity to build on her progress and support true gut healing. In phase 1 of gut healing, I started her on Digestive Enzyme Pro to support digestion, IgG Guard, which are immunoglobulins, to shield against intestinal inflammation, Probiotic 225 billion, which is a high-potency probiotic with lactobacillus and bifidobacterium, as well as Saccharomyces boulardii, a probiotic yeast known to help prevent C. diff infections in inflammatory bowel disease. Additionally, I had her use an elemental diet powder to provide additional calories and micronutrients. So she was actually eating over 3,000 calories per day and still losing weight. So I wanted to help stabilize her weight. So this is where the elemental diet made a big difference. So it's a powder you mix with water, and it does not require any digestion by the gut, and it has zero fiber, so it supports bowel rest. And she told me that the elemental diet and the digestive enzymes were game changers for her. Then we moved on to phase 2 of gut healing, and I started her on herbal antimicrobials, which are berberine pro and oregano oil to help clear the dysbiosis. I also recommended gradual introduction of prebiotic fiber to feed the good bacteria in her gut to make postbiotics, and butyrate, that critical nutrient that supports colon health and reduces inflammation in the colon. And eventually we discussed reintroducing tolerated cooked vegetables very gradually. To her credit, she was open to all of it. So on the outside, and according to her calprotectin level, she looked like a success story. And in many ways, she was. The carnivore diet had quieted the inflammation in her gut. This case really surprised me. In someone with ulcerative colitis, the carnivore diet functioned like bowel rest by eliminating all food sensitivities, fiber, and dietary triggers. And it worked, at least symptomatically and in terms of the calprotectin level. There's even a 2020 article published by research from Harvard Medical School describing a case series of 10 patients with inflammatory bowel disease who achieved remission using ketogenic and carnivore-style diets that consisted of mostly meat, eggs, and animal fats. 6 of the patients had ulcerative colitis and 4 had Crohn's disease, and the patients reported that their diets were pleasurable, sustainable, and improved their quality of life. So the conclusion was that ketogenic and carnivore diets hold promise in the treatment of inflammatory bowel disease, and I'll put a link to the article in the description below. Now, returning to our patient, I do want to be clear about one thing. Dysbiosis was still present. An inflammatory bowel disease is a complex autoimmune condition that's driven in part by microbial imbalance and dysbiosis, which is why I emphasize treating dysbiosis with herbal antimicrobials to clean up the microbiome and to continue strong probiotics. We also have to feed the good bacteria using prebiotic fiber and by gradually reintroducing select plant foods. So while her inflammation resolved and she clinically felt fantastic, her microbiome remained imbalanced. And that is what we are now working to correct. So here are my takeaways on the carnivore diet. Do I think that the carnivore diet is horrible for the gut microbiome? Well, honestly, I used to. But after working with these 2 patients, I've come to appreciate the nuance. And their stories reveal that the context matters. Let me explain. Let's start with the first patient who had persistent bloating from intestinal methanogen overgrowth, also known as methane SIBO. Do I think that the carnivore diet is a cure for SIBO? The answer is no. SIBO is driven by underlying root causes like slow gut motility, incomplete digestion of food, and dysbiosis. SIBO causes a lot of food sensitivities, which is why a person may feel better on a carnivore diet, which would also reduce the gas levels and improve symptoms. But it doesn't fix these root causes, and when fiber is reintroduced, the symptoms tend to come right back. In fact, the longer you go without eating fiber, the harder it may be for your gut to tolerate it again. In my practice, SIBO is one of the main things I treat every day. In fact, I'm a prior SIBO sufferer myself. So that's why I developed a 4-phase approach that's extremely effective because it addresses the underlying root causes of SIBO. So in phase 1, we promote motility with meal spacing and a prokinetic called motility activator. In phase 2, we reduce the gas levels with a low FODMAP diet, which restricts only certain types of fibers. In phase 3, we reduce inflammation using spore probiotics with immunoglobulins. And then in phase 4, we finally kill the SIBO bacteria using herbal antimicrobials. So if you're struggling with bloating and you'd like to learn my full protocol in detail, please watch my video on my herbal protocol for SIBO. Now let's reflect on our second patient who had ulcerative colitis. In her case, the carnivore diet was transformative, completely stopping her bleeding, resolving all of her symptoms, and normalizing her calprotectin, suggesting that all the inflammation was gone. So do I think that the carnivore diet has a place in the treatment of inflammatory bowel disease? Yes, but with caution. The carnivore diet can be an effective form of bowel rest by eliminating all plant fiber and reducing digestive burden. That said, my preferred starting point for inflammatory bowel disease is the autoimmune paleo diet, also known as the AIP diet. And that's because it's a lot less extreme and it allows you to continue eating some nourishing, low-inflammatory plant foods. The carnivore diet is more of a last resort for those who don't respond to the AIP diet. And even then, it should be followed by a strategic plan to rebuild the microbiome and re-expand the diet. So if you or a loved one suffer from Crohn's or ulcerative colitis and you'd like to learn my holistic protocol, please check out my video on inflammatory bowel disease. Now, what about going on a carnivore diet long-term? Well, the truth is we don't have long-term data on the carnivore diet. So there are things that we just don't know. Like, will it increase the risk of colon cancer? Could it raise the risk of cardiovascular disease? And what are the consequences of chronically low postbiotics like butyrate? Some studies suggest that high meat intake stimulates pathways like mTOR and IGF-1, which have been linked to accelerated aging and cancer risk. So that's why we must approach long-term carnivore with caution. So what does the research tell us about the carnivore diet? A 2021 survey published by Harvard researchers followed over 2,000 adults who self-identified as being on a carnivore diet for 14 months. Participants reported significant improvements in their health with very few adverse effects and significant satisfaction. Benefits included weight loss and improvement in body mass index, improvement in diabetes and hemoglobin A1C, which is a marker of the blood sugar over the last 3 months. They also reported improvement in gastrointestinal symptoms and skin conditions. But again, we lack the follow-up studies, 5, 10, 15, and 20 years down the line to understand the impact on cancer risk, cardiovascular health, and the gut microbiome. Here's what we do know from today's cases. The carnivore diet universally leads to low levels of postbiotics, which are short-chain fatty acids like butyrate. Short-chain fatty acids like butyrate are made when good gut bacteria ferment dietary fiber, and butyrate is the primary fuel for our colon cells, known as colonocytes. Here are some of the known benefits of short-chain fatty acids. They improve the integrity of the gut lining. They have an anti-inflammatory effect and immune regulatory effect. They support our energy by influencing our mitochondria, which are the energy powerhouses of our cells. And they influence our metabolism. For example, short-chain fatty acids stimulate the production of GLP-1, which is a satiety hormone. Research also shows that short-chain fatty acids protect against colon cancer, cardiovascular disease, autoimmune diseases including inflammatory bowel disease, Alzheimer's dementia, diabetes and fatty liver disease, as well as asthma and allergic diseases. Then why do some people feel great on a carnivore diet despite having low short-chain fatty acids and butyrate? Well, the carnivore diet, when done properly, induces ketosis, and there's a lot of scientifically proven benefits of ketosis, including weight loss, increased energy, and better mental clarity. Additionally, the liver produces a ketone called Beta-Hydroxybutyrate, which apparently shares many properties with butyrate. In this diagram, you can see that beta-hydroxybutyrate is made by the liver in ketosis and has a very similar structure to butyrate, which is made when gut bacteria ferment dietary fiber. Beta-hydroxybutyrate may support anti-inflammatory signaling, mitochondrial function, and colon health. So this ketone, which resembles butyrate, may be the reason why some people are doing fine on a carnivore diet despite having very low actual butyrate in their colon. In fact, a 2022 study published in Nature showed that beta-hydroxybutyrate can suppress colon cancer. Another study found that exogenous beta-hydroxybutyrate may reduce colitis in mouse models of inflammatory bowel disease. So beta-hydroxybutyrate may explain why some people thrive on a ketogenic carnivore diet, at least in the short term. So here are my final thoughts. The carnivore diet is the most extreme form of elimination diet. And for some people, it can really improve symptoms by eliminating all food triggers, and it can definitely promote weight loss through ketosis. It can also calm inflammation in autoimmune diseases like inflammatory bowel disease. But I wouldn't recommend it as a long-term solution, and here's why. It doesn't address root causes of gut issues like slowed motility, SIBO, leaky gut, or dysbiosis. It starves the gut microbiome of fiber, leading to low production of short-chain fatty acids like butyrate, and we don't know the long-term consequences of this. It may lead to constipation, depending on the status of the microbiome and the bacteria in your gut, and whether or not you're using probiotics. And remember, our bowels are one of the biggest ways we eliminate toxins. And finally, it may carry a risk of nutrient deficiencies. There's such a wide range in how people adopt a carnivore diet. Some people are just eating beef, while others are eating nose to tail and including the nutrient-dense organ meats. Others are including eggs, poultry, seafood, and dairy products. So here are the key nutrients to keep an eye on: thiamine and folate, calcium and magnesium, iodine, potassium, and sodium, and vitamin C, although it's thought that the high carnitine in meat may have a vitamin C sparing effect. So if you're only tolerating meat, that's actually a red flag that there's something going on in your gut. The bottom line is the carnivore diet can be used as a short-term tool if needed, but the ultimate goal should be to heal your gut, restore microbial diversity, and reintroduce foods with fiber that support long-term health. Remember, the healthier your gut, the more foods you should be able to tolerate. Unfortunately, I think a lot of people don't have access to a doctor who can help them heal their gut, so they're stuck on a carnivore diet. But I hope that some of my videos give you some insights on how you can work to gradually heal your gut. Now I want to hear from you. Have you ever gone on a carnivore diet before? If so, please share your experiences in the comments below. And what are your thoughts on the 2 cases I shared today? And if you're on a very restricted diet, I highly recommend checking out this video next on dysbiosis, which is a big root cause of food intolerances.